Come in, come in, come in, come in, come in. Oh, look how beautiful.
Thank you.
And this is Grandma, yes?
Grandma is my grandma.
That's your grandma?
No,
It's your mother? Oh, thank goodness. I was about to say, you look really young for your grandma.
My mum, yes. It's my mum.
Better take a seat there, Mum. Now, let's pop her out of here, onto there, and strip her down, but leave her nappy on, please.
Okay. That's all right.
And we'll have a chat. How are things going?
It's all right.
All right?
She's good.
First, second, third, fourth, fifth baby?
No, first my baby.
First baby?
First baby. I'm
Wow.
43. Doctor, it's like...
43?
Yeah, it's like $1 million for
$1 million?
maybe more.
Jeez.
Czy można im poić wodą?
Wow. So you're a very happy mum.
Oh, yes, I am, doctor.
Are you getting any sleep?
Sometimes it's problems. She have a problem with poo, actually, you know?
Does she?
Yeah, sometimes 2-3 days.
Breast or bottle?
No, now bottle, because I getting flu, so I have to take medicine, and after I stop. I know, doctor.
Well, do you know, it's not unusual for babies to have, a cycle sometimes, which may take several days. Does she really strain when she wants to go?
Yeah, it's very...
And is it very hard,
Yeah,
the stool, when it comes
hard,
out?
yeah.
Okay, we might give you something just to try and help that.
Okay.
Lots of hair.
Yes.
So there's the fontanelle, that's the soft spot up there, that's good. Well, let's have a little look at your ears, so plenty of cartilage there. Let's have a little, I'll feel these ones now. Now this is where we see how strong she is. Oh. And you're going to lift that head? Come on, lift that head up. Whoa! There we go. Oh, now look at that. She doesn't want to let go.
Oh, yes.
See, my children now 18 and 16, so they haven't needed this. Yeah.
So you forget actually how to put it now?
I can still... No, I remember how to do that. Hit good. Now, this is the last one, okay? So this is the one that mums hate.
Okay, that's
This is called the startle reflex. And we sort of keep it there nice and then we go, whee! And she startles.
Oh, yes. She always do like this.
That's good. Okay.
So it's all right?
Yes. Perfect. Do you want to put the clothes back on? Okay, so that's good. So it was a normal delivery or was it cesarean? Normal delivery? Good. Okay.
Yes.
Any problems since then? Ween, passing bowel motions?
Yeah, problem with the wee, doctor.
What happens?
How I can coughing.
And
It's gone.
So do you know what you need to do with that?
I'm exercise.
Pelvic floor exercises.
Yes,
Yeah.
I did, but it's
Really important. It means you need to do it more and more.
more and more.
Okay. And it's hard to remember to do it all the time.
Okay.
My mother-in-law
Okay.
used to, every time she stopped at a red light, so it would just remind her that she would have to do her exercises. So she'll be in the car doing this,
Yeah.
But you've got to remember to do it. So you need to make real effort. You need to do it all the time because you need to firm up those muscles again.
Yes, I did.
Okay.
Because I was absolutely.
That's a built-in babysitter. That's great.
Yeah, that's great.
That's for you.
Okay.
Okay, so you just need to go and wait again for the nurses so that they can do the immunisations, okay?
Okay, doctor.
Good luck.
Oh, thank you.
I'm sure you'll be fine.
Thank you, doctor.
Mum's here to help. She'll be
Yes,
fine. She's
yes.
been through this already.
Yes, she is.
Look how big you are now, see? She must have done a good job.
Oh, yeah. Thank you so much for your help.
You're more than welcome.
Thank you. Bye-bye.
Bye-bye.
I'm Dr. Tawana. Nice to see you.
Nice to meet you.
How are you?
Thank you. It's, unfortunately, it's Louis who seems a little unwell.
Okay.
Yeah, he's just got a temperature today.
Yeah.
37.9.
Okay.
Last time
Last time you checked,
Yeah.
okay. We say up to 37.5 is normal.
Right.
Okay. So going up to 37.9, it could simply be that he is warmer.
Right.
And that his body just hasn't been quick to regulate his body temperature. How long has he had that kind of gentle kind of rise in his temperature?
That was this morning.
Just this morning?
Yeah.
Okay.
Also, his nappies are smelling a little bit stronger than usual, but
yeah.
only by a tad.
Okay, so and that's urine rather than the poos, would you say?
Poo seems sort of normal.
Is he peeing normally?
Yes.
Yeah, that side of things
plenty
is
of wet
fine.
nappies, yeah.
Good. Hi, young man.
Hello.
Hello.
Can you say hello to the doctor?
Has there been anything coming out of his ears at all?
No.
Good. Temperature 37.7, so it's kind of just slightly above the kind of threshold. If you hold him looking towards you, I'm just going to have a quick check in and around his neck. Talk to Mummy.
Hey.
Say hi.
Are you not going to say hello to me? Louis.
Okay, so no glands that I can feel. And actually, while you're holding him, I'll have a listen to the back of his lungs. That's it. That's lovely. Perfect. Okay. If we swivel him round just a little bit, actually, if you wanted, you can lie him down across your laps. I'm just going to press on his tummy. That's perfect, just as you are. Hi, young man.
Hi.
Lips are moist, which is very good. Hi. He's got a lovely,
You're not gonna say hello?
lovely colour about him. He's not struggling to breathe, which is brilliant.
You enjoying that little massage there?
Yes. Don't normally get this on the NHS.
No.
That's a lovely smile there, young man. We're going to shine a light just in his throat, just to see how that looks. Here we go.
Good boy, aren't you?
Very quickly. It does make them gag a little bit.
Aww.
All done. Perfect.
Okay, good
So,
boy.
no sign of any obvious infections there. He's well hydrated, lovely colour, breathing beautifully. No sign of any infection anywhere. You look very well, young man. So no concerns from my point of view.
All right. Are you happy?
He certainly is. He looks it.
Thank you so much.
You're most welcome.
Right, say bye to the doctor now.
You're going to
Bye.
wave. We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic. Take care.
Okay,
All the best. Bye.
Bye now.
Hello.
Hello.
Right, which one's John?
Me.
All right, have a seat, John. I'm Julie. How can I help?
Every time I breathe in, I get a pain in my chest.
All right, okay. How long's that been going on for?
Since yesterday, you can hear it.
Oh, I can hear the wheeze, yeah. And it's normally asthma, Mum, or?
Yeah, he's got a little bit of a tight chest.
Yeah, so has he used inhalers before?
No.
No. Okay. All right, we're just going to...
When he was younger, yeah.
When he was younger?
Yeah, he was quite asthmatic, like...
Oh, he did have asthma when he was younger?
Younger, yeah.
Right, just stand up for me. That's it. Just breathe in and out through your mouth. You're quite wheezy there, aren't you? Just have a seat, John. Let's pop your finger.
Jimmy.
That's a good one. Okay. So what I'd like to do is give him the nebulizer, okay, and then I'll check him again.
Is it very serious?
No, darling, it's just your asthma that's just come back, that's all. I'll give you the medicine through the mask. So all it is, it's just the medicine, but it's just going through the mask, and it'll be like steam that comes out. Okay, so like steam in your face. You just have to breathe normally. That's it, good boy. Oh, it helps if I plug you in. Right, can you jump up off there for me, and I'll just start writing up his notes. That's it, good lad.
Hopefully you don't get worse.
So can you remember when he last used inhalers, Mum?
It's usually during the summer.
Just sometimes in the summer with hay fever, he might have some problems. And then does he use the blue inhaler? Don't press on anything. Or it might all disappear.
Feel better, Jimmy? In your chest.
Are they feeling any easier?
Yeah, it's feeling a lot easier, but I can still feel that a little bit.
Just
Oh, no. Thomas is looking straight at you.
I have to.
you're very curious, aren't you?
Kevin,
Wow.
I'm going to go back in. It's just I'm asking these two to stop playing up a bit.
Wait till that stops steaming. Just keep shaking it slightly just to get rid of those last few drops. Don't feel any better when you're breathing in?
Yeah.
Yeah?
I can breathe deeper now.
Good, good. So what I'll do, Mum, I'll give him some inhalers, and I just want to check his chest again. Oh, it's in your purse.
Kevin, we're talking to the nurse. Yeah, in a minute, Kevin.
So I think we'll treat him full on as asthmatic with the steroid inhaler and just to get on top of things.
Jimmy's not feeling well, Kevin, so you gotta just have patience.
Right, lovely. I think that's done now, isn't it? That's it. Good lad. Okay, so I just need to have a look at your brother again now. Okay, so you stand over there with Mum.
Good boy, Luke. Stand
That's
here.
it. Let's have you on the scales then. That's it. Okay, 48.
Stone.
No, that's kilograms. Okay, you jump up because I need to be here. That's it, thank you.
Kilograms.
Right, let me just check your chest again and then we'll get your medication.
It's a lot less squeaky than it was before.
Yeah. There's still a little bit of a squeak there, but it's a lot better. Sounds a lot better.
Luke, Kevin, why are you doing this, Kevin?
So he'll definitely need some steroids. Okay, jump up.
Don't steroids make you get muscly.
They might do, eh? So I'll give you a brown inhaler. Okay, so take 2 puffs in the morning, 2 puffs in the evening.
Okay.
And a blue inhaler. Okay, so the blue inhaler you take, whilst your chest is bad, take it every 4 hours.
So the brown one, 2 in the morning,
And 2 in the evening. Right.
Are we going in now?
What do you say, boys?
Twice in the morning, twice in the evening.
That's
do you
good.
say, boys?
Well done.
And
You take it to the nurse, okay? Thank you ever so much, nurse. I appreciate that. Lot.
All right then, take care. Okay.
Bye-bye. Say bye-bye, boys.
Get the stickers. There you go.
Thank you.
All right
Thanks
then,
ever so much.
bye-bye.
Bye-bye.
Right, how can I help?
I thought she might have thrush, but the doctor said she might have a urine infection as well.
Okay.
So
So did you bring a urine sample
I
in?
did.
Lovely.
It's happened in the past before. She's fine during the day, but then at night she starts really screaming and crying. It's hurting down below.
Yeah.
Really?
Yeah.
Okay.
So we didn't know what it was.
Okay, and in the last 2 nights she was saying this,
it's
and when
both.
you look down below, Mum, is there anything that you've noticed?
It's nothing. The inside is a bit red.
Any blisters, spots, anything
No,
at all? No.
no.
Okay. So you brought the sample, and
I
what we'll
did.
do is we'll dip the
Excuse
sample
what
and.
it's in.
Oh, it's
I
okay.
put it in a. That's all I had to put it in.
Just don't drink it.
No.
Mummy.
Yes.
It's like, wait.
It is. It's yours.
Is it her first morning one?
First wave.
Yeah, this is the wee.
Yeah.
This morning.
Yeah.
It's my wave.
Is it? No, there's no infection, so there's no blood. What I'll do is, can we have an examination? Is that possible?
Right, you're going to lay on the bed?
We'll just slowly have a look and just look. Is that okay? Do you want to come behind the curtain with her, Mum? Do you want to pop her on here for me?
Whoosh!
Can I take a seat? What can I do for Logan?
Right, well, we saw the doctor this morning about his, closed, droopy eye, and we were told if there was anything else to come back. He said he's getting a bit of blurred vision and double vision in that eye.
Look at me, Logan. No, not your game. Just look at me.
Let me hold that for a minute.
No, don't you.
I won't play it.
Why do you think it's droopy? A little bit full, isn't it? More than droopy, I would
Yeah,
say. It looks like the lid's almost a bit swollen.
Yeah.
It is not.
Is it not?
Doctor, felt, and she couldn't obviously feel
Thank
anything.
you.
Hang on.
Logan, will you do a few things to me?
No.
It's
Because you'll
on.
unpause it.
It won't. It'll be fine.
You do a few things to me, Logan. Copy what I do. Screw your eyes up as tight as you can. Really, really tight. Okay, and open. Lift, that's it. Eyebrows right up like that. Fantastic. And down. Blow your cheeks out. Go on. Okay. Now, follow my finger with your eye. Is that all okay? Now, this is the tricky one. Is that okay? Any problems with that?
I can even close my
You
eyes.
can do
there's
it
no
yourself,
problem
but
with
did
me.
you only ever see one of my finger?
Yeah.
Yeah, okay.
Can I just feel your tummy? Any pain at all? No. So if a urine infection, you'd get pain around here.
Okay.
No, that's fine.
That's good to know.
No, that all looks normal, actually.
Okay.
But because it's been going on for a while, I think we should try the anti-thrush treatment, because you said you've tried pseudocreme and it's not healthy.
Yeah, it doesn't seem to do much,
Yeah.
to be honest.
Stand up for me.
That's it. I'll let you get ready.
Good girl. Right.
So let's give her a tiny bit of the canister cream that we normally use.
Right, we'll sit back up. Oh, there we go. Ah, can you share with me? Oh, thank you.
So just apply it twice a day.
Okay.
And just for 5 to 7 days maximum, like a
Okay.
week. There we go.
Cool. We'll get you some proper cream. Make it all
Oh,
better.
you're so
Yeah.
sweet. Well, nice to meet you, Lexi. Oh.
Say thank you.
Thank you.
It's okay.
Yeah.
Right, come on.
Come on.
All right then. Take
Right,
care.
thanks for that, darling.
It's okay.
Right, you're gonna say bye.
Bye.
Right, let's go. Thank you very
Bye.
much.
It's okay. Bye.
My ears hurts.
I'm gonna check it now, baby. Oh.
Come through. Have a seat. Right, how can I help? Morning.
He does have an ear discharge from his left ear.
Right.
So last time when I visited the doctor, they given me 5 days of amoxiclav, and it subsided with that.
So when did he become unwell? When did this start?
Today morning, you know.
Right.
Today morning he wake up at 2 o'clock and he cried because he has an earache, and I given paracetamol 5 ml, and he slept.
So I did have a quick look before you came in. I know
Yeah.
because of the history,
Yeah.
he's had to go had chemotherapy, I
Yes,
believe.
yes.
Where is he in terms of treatment at the moment?
Treatment, he finished his chemo last July.
Okay.
So they are they are doing MRI scans every 3 months now.
Yeah, yeah.
And it's all clear till now.
That's good. George has had a very eventful life so far. When he was around the age of 3, he was found to have some developmental delay. He was subsequently found to have a tumour that's called a medulloblastoma. This is a cancerous tumour of the brain which affects an area of the brain called the cerebellum.
He wasn't walking, you know, when we were diagnosed with brain tumor. He lost his balance and he was in.
Yeah.
He improved a lot, you know, compared with the stories of other medulloblastoma children.
Sure.
He's a miracle now.
Well, that's good to hear. You must have, obviously, a lot of work for you and
Of course,
parents,
there
you
is,
know, having to do all this.
A lot of hard time, you know.
Okay. He's done remarkably well. He's an extremely resilient child, and his parents have been very patient with all the treatment that he has needed. What time was his paracetamol dose?
At 2 o'clock in the morning.
2 a.m. Any doses since then?
No.
Okay. So, George, I'm going to check your temperature, okay? Yeah. Can I see your hands first? Show me your hands. Great. Oh, you can do high five. Brilliant. That's good. All right, can I check your neck in the back? Yeah. It's mainly checking for the glands here. Good. All right, I'll have a look in his ear. All right, so I'm going to have a look in your ear now. Is it hurting you?
Yeah.
Which one's hurting you? This is hurting you? No, this won't hurt you. Okay, so this is the one that had discharge.
Yes.
Yeah, so there's kind of mucus coming out.
Yeah.
You can see.
Yeah.
Does this happen often? Or...
Since the chemo, you know, that was the 6 months back, you know, the first time it happened.
With chemotherapy, we always have to take extra caution as the risk of infections can become more complicated as the immune system can be much more ineffective and suppressed. When he was on chemo, did he need many courses of antibiotics?
Lots, yeah.
Just as a precaution, because obviously there might be some resistance to some of the things we could give. Do you mind if we just get a swab from the ear? It's just a small cotton bud.
That's fine.
It won't be painful.
That's fine.
Okay? I should have some in this room. Right, so I'm just going to tickle your ear. That's it. Good boy.
Good boy.
You're a good boy. Okay, good. So I'll give you the prescription. And it's 1 spoon, 5 ml, 3 times a day. Okay?
Thank you.
Good. Okay, George? Take care. Bye-bye.
Hi, this is Monish. She's a medical student. Have a seat. Right. And this is Sophia.
Yeah.
Yeah, and we were just sort of talking because we had a little look through. She was here a couple of days ago.
Yeah.
Right, so tell me what's been
7 days
happening.
now since
Yeah.
she's been having fever, cough.
Yeah, yeah.
Last time when I came in, and doctor says if anything gets worse, just bring her in. So this morning I found that her breathing was hard, like she's struggling in breathing.
Yeah.
Fever is still the same degrees, yeah.
What sort of level?
It was 38 sometimes and 38.5.
Okay. And we know she's got this problem with her heart still. Is she drinking okay?
She's drinking, oh yeah, okay.
Sophia's got a heart murmur caused by some backflow of her blood from one chamber in the heart to another, and it makes the heart have to work harder than it would do normally. Apart from her problem with her heart, she's got no other problems that I can think of, and no allergies.
No.
Okay. Should we have a little look at her?
Yes.
Okay, that's good. Okay. Hello. Oh, sweetie. I'm sorry. I'm just going to put this in your ear. Okay. I'm really sorry, sweetie. But you just hold it. I just want to check. Oh, sorry. It's just. I tell you what. Listen. Okay. Listen. That's all right. Okay. I think what I'm going to do is I'm going to try and listen in now, anyway, because I don't think she's going to stop. Oh, sweetheart. I'm sorry, sweetie. I'm not going to bother with her temperature because it's going to be very high, but I do want to have a quick look at her ears, if I may. I'm sorry, sweetheart. If you just hold her head, that's just the head on it. That's fine. You can hold. I know it's a bit of a struggle. Excellent. Sorry, that's all done. All done. Look. What's this? It's all done. It's all done. It's important that when children come to see the doctors, they go away feeling happy and content because they'll come back again the next time, not traumatized by the experience. If parents can talk to them about it, explain, then that helps demystify and helps reduce the pressure children feel under when they come to see us. I'm really sorry. Right, she is a poorly little girl. Her breathing at the moment, the rate of it, I'm quite happy with, and the ribs themselves aren't going in. But you're right to bring her back for us to look at her. It does sound as if there's some noises down in this area around the chest, which is different to the other side. It's a little bit sort of noisy, a bit rattly. It suggests to me that there is a chest infection starting there, which is why her temperature's still going up and down and why she's sort of struggling a little bit more. I feel she would benefit from some antibiotics. The proviso is if she starts getting any of her ribs going in or her breathing gets worse or her nose starts going in and out, then you need to come either back straight away here or take her straight away to hospital. Okay? Does that sound okay?
That's fine, yeah.
Okay. Okay.
Thank you so much.
You're very welcome. As I said, even if you have to bring her back this afternoon, don't feel that you can't. Okay.
Thank
Okay.
you so much.
Not at all. Take care. Bye-bye.
Bye-bye.
Bye.
How can I help?
She's got temperature for the past 2 days.
Mm-hmm.
She's got some problem with her tongue.
Tummy.
She's complaining of ache and
Okay.
she's farting and it's aching when farting.
Okay. So how long has she been unwell for?
2 days.
She's got a temperature now, you know.
Yeah, we've given her Calpol at 4:30 this morning.
Her glands are all up as well. So she's had a bit of diarrhea, any cough, cold, sore throat, or anything like that?
She's got runny nose a bit.
Go, my neck will go. Make the noise. Okay. Is it sore at all?
Yeah, it hurts.
It's okay. Do you want to jump up on there and we'll have a feel of your tummy? Your tummy pain, when did it start?
When did you start with the tummy pain?
It started yesterday.
Where did it start? Can you point?
There.
There. Is it still the same place or has it moved anywhere else?
It's not hurting anymore.
It's not hurting anymore. Okay.
But it's just.
When did she last have diarrhea?
Yesterday evening.
Yesterday evening.
My heart's when you press it. That hurts.
What about this side? No? It's probably a viral gastroenteritis, okay?
I'm just checking it's not her appendix. Okay, do you want to just come and sit here? Yeah, I think we need to take one thing at a time today, okay? I don't think this is anything more than a viral illness. And the problem is that viral illness will present in many, many different ways. From now on, though, Calpol, Nurofen, regular fluids, rest, and diarylitis. She's getting lots of diarrhea, get some diarrhea. I think she'll get better by herself.
Okay.
See you later. Bye-bye.
Hello, how are you?
Went to the pharmacy to pick up the other
That's right,
prescription.
that's right,
And he woke up, and when he woke up, it was just.
Yes, I see. That's right, yeah.
Yeah.
And the other eye seems to be pretty good.
Yeah.
Hello, how are you? Well, I think it is worthwhile treating it because it is quite red and there's quite a lot of pus in it.
Yeah.
And my suspicion is that it's going to get worse. We don't treat these most of the time. They're viral.
Yeah.
Most of them, they clear up. But this looks to be something that's getting, has the potential to get a lot worse a lot quickly.
Yeah.
So we give him something just topical into his eye. And I would like you to use it for 5 to 7 days, depending on how you get on.
Okay.
We're going to give him drops.
Okay.
Yeah. It's highly contagious, so it's very important that you wash your hands after having administered the drops. And then bathe his eye, just rub it around with a warm compress, clean out the green exudate.
Yeah.
But not allergic to any antibiotics as far as you know?
No.
As soon as the pharmacist was trying to describe it, I knew it's something I had to see.
Yeah.
Because sometimes these can be fairly mild.
Yeah.
And sometimes you can see in the speed it has developed.
Yeah.
That's
How
right, yeah.
quickly it's
Mhm.
come.
Good.
Thank you very much for your help.
You're welcome. Nice to see you. Bye-bye, Sebastian.
Bye.
Bye-bye. Thank you for coming in.
It's meant to be like really clear, isn't it?
Not clear, it's meant to be a light yellow.
It's like orange.
Reese.
Oh, yeah.
Hello, Kelly.
Hello, back with this one now.
Hello, how are you?
Sit there. Give that to
Right.
the doctor.
Oh, thank you very much. I get all the nice presents.
I know. We were sitting there holding it.
So, what have you had done? He's had some surgery, yeah?
Yeah, he had a circumcision. He's had problems with his peeing for like the last couple of years.
And so they did a circumcision?
Yeah. Took the foreskin off, hoping that might help the pee flow, but it hasn't.
Okay, so the pee flow hasn't got worse since
Yeah,
the
it
surgery.
has.
It has got worse. Is it hurting him to pee?
Yeah.
And before he had the circumcision, it was the same sort of thing?
Yeah.
Lots of trouble passing water?
Yeah. And last night he was up and down, and he's pushing, and it's not coming out.
Is he opening his bowels?
Yeah.
He's not constipated?
No.
Because if he's constipated, that can cause problems with emptying your bladder, no?
No. You go every day, don't you, for number 2?
Yeah? OK, let's have a look at you then. Can you climb up onto the couch for me, sweetheart?
He drinks a lot as well.
Oh, wow. That's impressive. I don't think I could get all the way up there. Pull down for me, sweetheart. No, that looks OK, doesn't it?
Yeah.
Nice and tidy. Does that hurt, sweetie? No?
A bit.
A little bit. What we were worried about was whether or not there was urine stuck in his bladder there. There's no urine there. You can see how my fingers go right in. His tummy would be really hard and you would feel the bladder.
But he goes up and down, and he's not sleeping.
Absolutely. Come back
so
across, darling.
He's
I'm not done.
tired in the morning when we have to go to school. He's shattered. And he's not sleeping till 12 o'clock. He goes to bed at like 9. And he's up and down, up and down.
Right, so I don't think that there's any urine stuck in there that isn't coming out, but obviously it's not right.
Yeah.
Looks a tiny bit red, but not obviously infected, but there's some white cells and some protein in his wee, so it may well be that there's an infection higher up and that's what's causing his problems. What we're going to do is send that off to the hospital.
Yeah.
And we're going to give him some antibiotics.
Yeah, that'd be lovely.
Lots of fluids to keep drinking. You're giving him some paracetamol for when it hurts?
Yeah, Calpol.
Perfect. OK. Is Reese allergic to anything? Is there anything he can't have?
No.
Now, if at the end of it he's not right, we want to see him again. Yeah. If the sample comes back showing he needs any different antibiotics, we'll be in touch, okay?
Yeah, and in the meantime, if you finish the antibiotics and it's still no better, we
bring him back. Yeah. There you go, Reese. Do you want to take that off to the chemist?
All right.
Good boy.
What do you say?
Thank you. You take care, okay?
Thank you.
No problem. Bye-bye.
This way, chemist. This way.
I blame it on him not running. As soon as I cut out the exercise, I've just gone. I need to get back into it. It's Saturday in a minute.
Why can't I enjoy it like that?
What?
Running.
Oh, I run weird. You know,
I
like
run.
Phoebe, your
Phoebe,
friends. Literally, watch.
Victoria's Panska, please. Come in, take a seat. How can I help today?
Yeah, yesterday she told me when she take her right hand up,
Yes.
in breast side, she feels something hard and pain.
Uh-huh.
You can show, doctor?
Any lump or is just painful?
And I feel something hard.
Okay.
Like something like, for example, like stone or something.
Okay,
I feel.
all right.
Show what you feel.
Can you show me what you feel? Is it painful? How did you notice it?
Yesterday when she's sitting in the room,
Yeah.
she just put like hand. Sometimes she like put
Yeah.
somewhere hand
Yeah.
evening, and she told me she feels something hard, and
Uh-huh.
when she touch, she feel pain.
Okay. Anyone in the family with breast problems?
My mother-in-law.
Mother-in-law, so her grandmother, yes?
Yes. Mm-hmm.
And what's the problem there?
She got breast cancer.
Okay. It's that, isn't it? Yeah. It's very hard, isn't it? Okay, good girl. Now put your arms all the way up. All right, so what we'll do is refer her to the breast clinic and they can check that out for her. It's quite firm. It might be part of the rib bone potentially. Sometimes you get cysts and things, but I don't think there's anything worrying. I mean, she's only 9 years old, but we'll just get it checked out. It's not a problem. Is that okay? So you should hear from the clinic. Usually takes a couple of weeks. They're usually quite
Yes,
fast.
no
Yeah.
problem, no problem.
We'll just get
We
it
can
checked.
wait.
Okay?
Okay. thank
Lovely.
You so much. Thank you. Bye-bye.
Bye now. Hello. Come through. Have a seat.
Mr. has a very bad cough and a very bad sore throat, it seems.
Okay, tell me, when did it start?
Oh, I've had it on and off for a week now.
Okay.
We're struggling to feed him, basically.
Okay, and how's the breathing?
He's got a floppy windpipe, so his breathing's going to be erratic, and he's had a viral ever since he's been 6 weeks.
So there's been no change in his
No
breathing?
change at all.
Okay. And how long has he been feeding the way he's been feeding?
It's been about a week.
Any temperatures at all?
No, and I think you've done smelly. I can smell it. Thank you, son.
Is he having wet nappies? Yes. Okay. All right, let's check him over.
Yeah, that's fine.
We'll start off with his chest and then we'll do his temperature and
that's
look at his
fine.
ears and throat. Okay, do you want to bring him over here? Sure. Just leave him the way that he is for the moment and we can check him over. Okay, so just one hand at this one here and one hand on his forehead here. That's great, perfect. So if you sit him up, it might be easy if you put one hand across here and one hand on his forehead. That's perfect. Oh, little man. Oh. Okay. Does he bring up a lot of his feed?
Yeah. He's on Gaviscon.
So I think what he's got is something called bronchiolitis. It's a viral infection, combined with the fact that he's not feeding as he should be.
Yeah.
And the fact that he's so young.
I would like the paediatricians to review him.
Hospital?
Yes.
Who are you looking at?
Hi there, my name's Dr. Deary. I'm a GP from Farnham Road Surgery. I've got a 15-week-old boy I'd like you to review for me, please. Sounds like he's got bronchiolitis. My main concern is Mum says he's not been feeding. On examination, he's afebrile, respiratory rate of 48, heart rate's normal. Thank you so much. Bye. Right, there you go, Mum. All the best. Take care, right? Like I said, it's just to be cautious and for monitoring. Let's see how she gets on, all right?
Come, Phil.
Hello. In we come. Come in, take a seat.
Thank you.
How are we doing?
Yeah, actually, he's coughing.
Right.
All night.
Yep.
All night he was crying with a runny nose and coughing very badly. And he vomiting as well. He bring all milk out. So that's why we're worried about it.
Okay, we'll have a listen to his chest, shall we?
Yeah, that's fine.
And see what it's like. Let's have a quick take of his temperature. Oh, that's a smile, isn't it?
Yeah.
Thank you.
All night he was crying and now he's smiling.
Absolutely. Well, there we go. There's a cough as well. So we're going to have a listen to that. OK, if you just pop his head to the side slightly and we'll just try this temperature first. OK, so no temperature, which is good news. We'll have a listen to that chest before he starts crying. Oh, you're not going to cry, not when you look so happy.
All right, or shall I remove the...
That's fine.
Is that right?
OK, so his chest is nice and clear. He does have a little wheeze to it, OK?
Yeah, sometimes I
wheezes,
feel like when he breathes,
you can hear a slight wheeze at the moment. Now, OK, so let's talk about the good signs. OK, the good signs are that his breathing is nice and slow. He's not panting. He's not panting away very fast and rapidly, which would be a bad sign. He's not grunting when he breathes. Like that. That wouldn't be good. He does have a little wheeze, so there must be a little bit of narrowing of his airways to some degree. All he's got at the moment is probably a little viral infection that's given him a slight wheeze, OK? So what we need to do is give him, he's only tiny, but that we can use an inhaler to try and help that. What I'm going to see if I can do is get one of the nurses just to show you how to use that.
All right.
OK? 2 seconds. Let me see if I can convince one of my colleagues.
Yeah.
I mean, don't worry if he gets a bit upset and, you know, if he's crying when you're trying to give him it, because sometimes that's better, because as they're crying, they're taking deeper breaths.
Deep breath,
So it's...
the medicine goes in.
Yes. And pop it in. Okay, right, so we'll just see how he takes it. What's that? Good boy. Oh. That's it, good boy. So this is just to help with the cough whilst he's coughing so much. All right, okay then. All right then, take care, bye-bye.
So something for his skin, is it?
Yes, please. That's the one.
So mometazone?
Yeah,
that's a really strong steroid cream.
Yes, sir.
This is not something that we would ever put on repeat for a child. Importantly, what we need to assess is how is his eczema?
His skin is fine. If you can have a look over here, everything is...
So you can see there's some redness just here, can't you? Kind of classical eczema, dry skin.
Yeah.
How about his arms?
Arms? It's here.
Oh, wow. OK. How about legs? I like your trainers. OK. So that looks quite sore, doesn't it? You can see he's been scratching at it. OK. What's his bath time routine like?
His bath time routine is like two or three times a day, a week.
OK, so not having bath every day. We know that things like soaps, shower gels, bubble baths, they all make the skin dry. He doesn't use any of those. That's perfect. What we could give you is a tub of cream, and when he is having a bath or a shower, you can rub that in all over the body and then just wash it off. Twice a day is good. It would be even better if it was 3 times or 4 times a day. Here's the crucial bit. Eczema is a dry skin condition. If you chuck moisture at dry skin, it's going to be perfect. It will work. That means then you don't need the steroids. Because we are really reluctant as doctors and clinicians to give steroids, especially in a child as young as Nirmit, who his skin is not going to be like your skin. Okay, it's going to be thinner. And steroid side effects are that they make the skin even thinner. So these should be reserved only to use when there are flare-ups of eczema. I'm really concerned about how strong that is.
No worries.
And at the moment, actually, his skin's not that bad. It doesn't need the really strong steroid. So I'm going to keep those 3 things on repeat. So Cetraben will be on repeat, soap substitute tub on repeat, and an antihistamine to drink once a day. And that's his regular treatment. That's the time to come and see us, and we assess the need for steroids.
That's fine.
All right? And it looks like we can send this prescription electronically just to the pharmacy. I'll do that right away.
Thank you very much.
You're welcome. Nice to meet you too.
Come on,
Take care.
Say bye.
Bye-bye, young man.
Bye-bye. Have a nice evening.
Be good.
Enjoy.
Take care, you too.
Good morning, Logan.
Morning.
Hello. All right, what's wrong with you then?
He's had a temperature now for a few days with a little bit of a sniffle.
Yeah.
But he's started to get this cough now, so and because of all these other issues, I thought I'd just get him checked out.
Do you want to take your jacket off and let's have a listen to your chest?
He's had a temperature. It's not been sky high. It's like been 38.7.
Okay.
So it's not.
Is
massive.
epilepsy well controlled?
Yeah, it seems to be at the moment.
There we go. Listen to your back. Crystal clear.
Okay, that's good.
Okay, I suspect it's viral. Most of it is at this time of year,
Yeah.
which will cause him to have little spikes in temperature and things like this. Paracetamol, as you would normally take, regular fluids.
Okay, excellent. And one of his ears is hotter than the other one. Which one was it, Logan?
This one was
That one.
hotter than that one.
Yeah.
You wouldn't get a different temperature because of anything.
Okay.
This is not going to work. It's not been working for 2 weeks. I don't quite know why.
Battery's changing?
Maybe. I think it might be the bulb.
Yeah, maybe the bulb's gone.
Right.
Right, let's hope that it is the bulb.
Yeah.
And not the whole thing's completely blown.
Do you want to stand up for me? It needs new batteries. Yeah, right, here we go.
Yeah, normally the lump has to touch the
Yeah, it's worth
little metal bit, but the thingamajig has to touch the thingamajig.
it. Right. We've got a light, I think.
Oh, that's good.
Put your head away for me. That is absolutely normal. So we'll go the other side.
Your brains haven't fallen out then, Logan.
No, that's what. There's a bit more wax on that side, but that's also normal. I think this is just a little viral cough.
Okay.
You're fine. Off you go.
Good.
Take it easy. See you later.
Thank you very much.
No worries. Bye-bye.
Hi, how are you?
We're not well. No, see, we're not well.
We're not well.
No, we're not well.
In what way are we not well, Malachi?
He's got a rotten cough.
Yeah, since when? When did that start?
About 3 days now.
Yeah. Mm-hmm.
He's not eating very well,
Yeah.
and he's not drinking very well either.
Okay.
But we still have had some wet nappies, so I'm not
Okay.
too concerned.
Yeah. Is he running round?
Apparently not.
I think this is his stock answer to every question. He'll shake his head.
One
We're just going to
minute.
take your temperature, Malachi. It's okay. Good. Can we pull this Batman up? So tell me, is it true that you are actually Batman? Or are you just wearing? I can hear your chest better when you scream, you see. I can. Yeah, good.
No, you're done.
We're all
You're done.
finished. All
It's
finished.
all right. It's all right.
Yeah, so he's got a very mild viral pharyngitis. It's a slight viral infection of his throat. His chest is really good. He's obviously got the same virus in his nose. Ears normal, neck normal.
Can't we just take all the bugs out of my baby?
He needs those bugs to strengthen his immune system so he doesn't come down with
It's all
important
right. He
diseases.
doesn't need an immune system. I'll stick him in a bubble. It's fine.
Oh, I see. Okay. So all you've got to do, give him something like Calpol. It's going to kind of feel like this still. Same symptoms about another 48 hours. They begin to disappear at that stage. But of course, they could come back.
If
No,
he...
we don't want them to come back. We can positive things, please.
Well, do you want the truth or do you want fiction?
No, we want facts.
Yeah, well, facts.
Bit of fiction at the end, though. Yeah?
Hopefully it won't be fiction.
Rhetorical question at the end.
Oh, very good. I'm very impressed. I'm very impressed.
And a tip.
What's your top tip for today? Have you got a top tip?
To brush your teeth.
I do.
Yes, that's very good. They're really important. So important for your health to brush your teeth every day. Top tip for health. When you're feeling cold and unwell, honey, lemon, cloves, whiskey and hot water.
All right.
How are you?
Remember me?
I recognise you, yeah, you've been here before. This is the third lot of injections today. So we have 3 injections. Hello. Hello, how are you today? Oh.
Yes, happy before vaccination.
Yeah, happy before. OK, so we've got the meningitis B again. The other one is the pneumococcal one for pneumonia. And the last one is the one that's got the 5 things in, so the tetanus, polio, whooping cough, diphtheria and Hibs, all in one. So who's going to hold him?
Me.
You're going to be the brave one. You ready, baby? I'm sorry. One more. In that leg. You hold him really still. Sorry. And then let's turn him over. Good boy, good boy. Okay, just hold him really tight. Hold on. There you go. Hold on.
Big tears.
Sure. You can have a sticker for your brother. What one would you like? I'll give you one of those. Because you was brave watching. There you go.
Thank you.
So the man himself. Hello, gorgeous. Hello. Do you think it might be worth a little smile? Yes, absolutely. So, start at the top and work down. Soft spot there, which is normal, that's fine. Baby's born with 2, and the back corner's closed up, which is normal at this age. No lumps or bumps you're concerned about?
I haven't actually.
You haven't noticed? Just sit up for me. That's really not bad head control, is it?
Oh, he's been controlling
I think
his
that's
senses.
really rather good.
Day 1.
Let's drop you back very carefully. And he still startles, which is normal at that age. What do you think? OK, sweetheart.
Like head.
Do you not like that? Goodness!
Put the hat on.
You don't like hats? You're not going to be a hat baby? Poor soul. Oh. Right, I'm going to let your mummy put that nappy on because we're dicing with death here, really, aren't we? That is a completely normal examination, OK? Everything there that should be, everything doing everything it should. Lovely. So, he is fit for his immunisations. That swab will go off. We'll let you know if there's any problem. You'll have a think about what you want to do for birth control. You'll keep an eye on the scar if you're concerned. You'll call us again, OK?
Sure.
Great.
Thank you for your time.
It's no problem. He's lovely.
Later.
Take care. Bye-bye.
Nothing to worry about. There's nothing to worry about, lovely.
Feel better.
All right, tell me, what's wrong with this little boy?
He's been ill since Sunday night. He's been having really high temperature, burning up to touch. He's hardly drinking anything. He hasn't eaten in 72 hours. And he's come up with...
Yeah, has he got it anywhere else?
down his neck.
Has he got it on his tummy or anything?
No, don't.
No, it's okay.
No, don't.
Oh, actually, we're going to listen to your TikTok.
I don't want it.
It's all right. We're just going to listen to your TikTok,
Mommy,
darling.
I
This
don't
doesn't
want
hurt.
it.
This is just... Listen, I can hear your TikTok now. It's going TikTok, TikTok, TikTok. Good boy.
Mommy, I don't want it.
You're being very brave.
No, I don't want it.
Now, we're just going to look for some strawberries in your ears. No, there isn't one on that side. Is there one on the other side? Oh, it's all right, baby. It's all right. Let's have a look. Let's have a look. You're ever so good. Nah, no strawberries. Well, that's no good, is it?
See?
I think there might be one in your throat.
Mommy,
You're going to go, ah.
no, I don't want it.
Listen, look, watch me do this.
Right, open your mouth, look, copy mummy. Ah.
Mommy, I don't want it.
Okay, I'm going to have to hold you then.
Mommy, I don't want
Good
it.
boy, good darling. I know. Oh yeah, you've got rip-roaring tonsillitis, young man.
He's
got what?
Oh,
He's got what?
tonsillitis.
He's never had that.
We give him some penicillin. 1 spoon 4 times a day for 10 days to kill this particular bug, okay? For the next 48 hours, regular Calpol, ibuprofen, keep his temperature down while the antibiotic starts to work.
See, look, they give you some medicine, make you feel better.
All finished now.
You say thank you?
You were a very good boy.
Okay.
Should we go take this to the pharmacy? Come on then.
Bye-bye.
Thank you.
Right, take care. Hi, I'm fine. How are you? Zane's here for his preschool boosters. Does he know what he's here for?
Yeah, he's not really happy about it though.
No. So he's here for 2 in today. So it will be his second MMR and his booster of his tetanus, polio, whooping cough, and diphtheria. So he's got 4 in it. Okay, so it's 2 injections, 1 in top of each arm.
You're ready for it, aren't you?
Are you going to be a brave boy? Are you going to be the bravest boy I have in here today? Oh, brilliant. So if we put his hands, if I pull these up. Sorry, sweetheart. I know you don't want to have it,
You said you were going to be brave.
I want you to be a brave boy. Some of them are worse than this, don't worry. It's all right, Zane. I know.
If you move your arm,
If it's going to be worse, good boy. Oh, well done. That's the first one. Good boy. That's the first one, Dad.
One more.
One more. Good boy. Nearly done. Just stay still. Good boy. Good boy. All done. Just a little bit. There you go. All done. Good boy. Mum needs some. I think Mummy needs a sticker as well. So which one do you want? You choose which one you want. You want the big one?
This one.
Where are we going to put it? On here or on your top? Other top? Should we put it there? Do you want? There you go. Mummy's got a sticker. You were very brave. There we go. There's your book.
No more.
All done.
Thank you.
That's all right.
Have a good day.
Thank you. Take care. Bye, Zane.
Not your friend now.
Bye.
Say bye.
Bye.
Wet and miserable out there, isn't it?
Yes, very.
Right. Now, what can we do for Cody?
Well, basically, I'm here to see if there's any chance that you'd be able to refer him for me.
Because?
Because he's, for the past God knows how many months,
Yeah.
he's constantly got diarrhoea. I could change his nappies as much as you'd change a newborn.
Uh-huh.
My nephew's got celiac disease.
Right.
So's my uncle.
Right.
My brother had milk intolerance when he was born.
Yep.
So I was just seeing if maybe there's a way of testing him, if any chance it could have been
Related
with
to
him.
an intolerance,
Yes.
yeah. It's certainly possible. There's a long history of people there with it, isn't
Yeah.
there? Is he putting on weight and stuff?
He's only £25.
So he's not...
He's
not
very
as ill as
little,
you do,
yeah.
Okay. And does he seem to sort of get irritated by actually having wheat products like bread
He
and
refuses
stuff?
to eat.
Or... So he's refusing to eat it really, is he,
Yeah,
as well?
it's literally, he'll just throw his food. If he does, he'll literally just not
Is he still
interested.
having milk or not?
Milk, he's not having it as much, but sometimes I can give him like tea or maybe
Yeah.
a hot chocolate or something like that.
Yeah. Celiac disease is an inflammatory condition of the bowel where the body attacks itself, caused by the gluten sensitivity that they have. It's not an allergy and it's not a food intolerance. Children with celiac disease get very similar symptoms to adults, such as the stomach pain, diarrhea, and sometimes blood in the stool. If celiac disease isn't treated properly in a child, they may be failure to thrive, where they don't grow properly, and if it becomes very severe, they may not reach puberty when they should do. If it's treated properly by removing gluten from the diet, then none of those things will happen, and they can lead a normal and happy and content life. I mean, it's possible that he's intolerant to any of those sort of things, and normally what you do is try and exclude it with this group and then see.
Yeah.
I think because you've got sort of quite a long family history of various things, and he's underweight, it might be worth then just sort of seeing one of the paediatricians with a view to perhaps looking at doing some...
Yeah, that's fine.
Does that make sense?
Yeah.
Yeah? Otherwise, you're happy with his development and everything?
Everything else is fine.
Fine, yeah? Yeah, you look bright and alert. Good. Well, I'll drop them a line with a view to sort of looking at testing for all of those conditions. Okay.
Yeah, that's fine.
All right.
Yeah. Okay, that's brilliant.
Okay.
Thank you.
Righty-ho. Here, so I'll grab that door. And
Thank you.
You
Come
can
on
get
in.
out.
Come on in. Bye. Thank you.
Okay, take care.
And you.
Come in. More coming? Oh my goodness, how many more?
Too many.
Too many. Right, who's first? Good, what's the problem?
She's got very nasty cough, so she's been having a fever from last week. It's better now.
Okay,
but
so we have a listen,
in terms of the temperature, but...
Shall we lift this up at the back?
Oh,
my goodness. Oh, you're very good. Let's have a listen. See. Deep breaths for me. Another one. One more. Good, okay. Look, she's fine. The fever's gone, okay? So it means the acute infection's over, okay?
Yeah.
You still have some inflammation of those airways, and the result of that inflammation is that the body says, look, well, there's something here, let's try and get rid of it. So the cough will go on, but there's nothing that we can give her that's going to change that, okay? This is up to her own immune system to finally get on top of it. And he's got the same thing. Family share everything. Although he feels hotter to me. So he's different because he's got one side over here is really crackly, so he does need something.
That's the first time you haven't cried at the doctors.
Oh, do you normally cry at the doctors?
Oh, yes. You like doctor, yeah?
You like the doctor? Good. Okay. Because don't forget, it's not the doctors who are nasty, it's the nurses. They're the ones that always... The doctors are always very kind, the nurses, ooh.
It's not funny?
It's not funny, oh dear, okay. So you need to give him 1 teaspoon 3 times a day, okay?
Okay.
Keep going. If he's getting fevers and temperatures, you need to keep going with Calpol or Nurofen, yeah? Make sure he drinks lots of fluids. If he's off food, that's not so important, okay? He's not a thin child. He needs to think about a career in rugby. That's a good sport.
Oh, yeah. Yeah.
Start them early. It's not funny either. Oh, yeah, I'm failing.
You're gonna be ballerina?
I'm failing terribly today. There we go. That's yours. Can you hold that for Mum?
Thank you.
Thank you, doctor.
Thank you. Are you going to shake hands? Very good to see you. Are you going to shake hands as well? See you later, everybody.
Thank you very much.
Okay, any problems you're worried, come back, yes? Bye.
I'm Julie. How can I help?
And she has a very worse head leak in her head. So I go to the pharmacy. Last time I come for the doctor say buy from anywhere, but the pharmacy say without doctor prescription they're not allowed to shampoo to the children.
All right, for the head lice, they
Yeah.
can't get it from the pharmacy. So have you noticed any head lice?
Yeah.
You have?
Yeah.
And when did you...
I use lotion, but it's not work well.
Okay, let's have a little look, Poppet.
Lots of.
Is this where you're itchy, back here? Yeah, I think these are just the little eggs, aren't they? Yeah.
After lotion, when I come, lots of lies on the paper. Lots
You've been using the little tiny comb?
Yeah.
So has this little one got head lice as well?
Yeah.
And have you got any, so you've not been able to use any treatment for him either?
Not.
Okay, so this is the one that they recommend, the Malathion lotion, because I think sometimes some of these over-the-counter ones, the nits have got resistant to them, so they're not effective. But you're doing all the right things by using the comb and getting rid of the lice that way. Once you've treated it, just keep her hair nicely tied up and out of the way. So that's the information there. You can get more information online if you need.
You okay?
Sorry, he's vomited on the floor.
Oh, you're not well.
She started just coughing and she was vomiting and she couldn't even eat.
It doesn't hurt.
Big ah, as loud as you can, like a tiger. Ah. Very good. How can I help with Alessia?
Alessia's been sick for the past 2 weeks.
Yeah.
A bit of temperature.
Mhm.
He was going school and I was giving him Nurofen and Calpol. But now things for the past 4 days have become terrible. Cough, sore throat, bad smell from his breath. In the night, he shivers a lot. And fever, he's
How high is this fever?
around 39.
Okay, well, just slip off your anorak and your jacket. Yeah. That's right, good. Just have a look at your throat. Just open your mouth like a big shark. That's right. And say, oh, and loud and long. That's really good. Yeah, he sounds for horse. Let's just listen to your chest, Alessia. Big breath. Again. Nobody smokes? Just my dear, yeah. Yeah, the issue with smoking is that even if you never smoke in the house, the nicotine paralyzes the little cilia, the little hairs that are inside in the ears, the nose, the throat, and the lungs. And these little cilia just are like an escalator. They keep the mucus moving, and the mucus traps bugs and viruses. And then you clear your throat and you swallow the mucus, and that's how you clear your lungs. In children of smokers, that doesn't happen. And so it's easier for them to get ear, nose, and throat and chest infections. He has a chest infection at the moment. And so we give him an antibiotic.
He's literally stopped eating anything except for a piece of bread. Can I give him ice cream that's soothing it?
Yeah, you can, absolutely, yeah. So jelly and ice cream, you could give
Jelly
them.
and ice cream?
Yeah, yogurts, mousses. So fluids with a very high water content would be best. Custard. Good, yeah. Doesn't matter if it's hot or cold, just not too hot for him. He'll still be coughing, I'd say, for about another 2 or 3 weeks, so don't worry about that. But clearly, if you can help Dad, every cigarette Dad smokes takes 11 minutes off the end of Dad's life. But also, I'm just thinking about Alessio in this case. There's a poster upstairs, in the waiting room upstairs. You pop up and just take a photograph of it. It might just help to stimulate your determination to kind of think about stopping, you know. It's hard, but it's well worthwhile. You live longer, you'll be a lot healthier, and you won't be heir to all the things smoking brings us. Okay.
Thank you so much.
You're welcome, yeah, all the best. Bye-bye, Alessio. Hopefully you'll feel better soon. Yeah.
Thank you.
Yeah. Bye now.
Hi, I'm Dr. Taylor. I've got a medical student with me today.
Okay.
Is it okay if he initially asks you some questions and examines, and then I can step in afterwards? Is that all right? Yeah?
Hello, my name's Simon.
Hello.
One of the final year medical students. And so is this Mary?
Yeah.
Hello, Mary. Hello. So what's brought you in today?
She got an ear infection.
Okay.
Yeah, this is the third time.
Okay, so she's had it quite regularly.
Yeah,
Okay.
in few months.
Mm-hmm.
Yeah.
Okay.
It's in her left ear.
In her left ear. And has it always been in her left ear?
Yes.
And so have you noticed any discharge from it?
Yes, it's coming. I just cleaned the outer ear, but
Okay.
still coming.
Yeah, okay, you can see bits there, yeah. Okay. And is it being kind of red and sore and...
Yeah, she was, last night she woke up around 1 o'clock and she told us that she's having pain.
Yeah.
So, and she was having temperature as well.
How long has this pain been going on, or this episode?
She complained pain last night.
Okay then. Has she been eating and drinking all right?
Oh, she's not eating much. Drinking, she's okay.
She's drinking
yeah,
okay?
She's drinking, yeah.
Okay, and urine output, that's...
Yeah, that's fine, yeah.
She's still... Okay, and how about she opening her bowels still?
Yeah, once a
She's
day
not,
she
not abnormal, no diarrhea or anything like that?
No.
All right, then, is it all right if I have a look in your ear? I'm going to look in your ear, okay? Oh. That's it, that's fine. Yeah, that's it. So, yes, it does seem like obviously she has infection in the ear. That ear looks okay, although it is quite waxy,
Yeah.
so I can't really see too much.
Mhm.
But it doesn't appear to be painful. It's not that painful on the outside at all. She seems okay in her throat, and her chest is fine. So I think it would be worth giving her some antibiotics. Has she had the eardrops before?
Last time they gave amoxicillin syrup, oral syrup.
Oral syrup?
Yeah.
Okay.
Do you mind if I have another look in that left ear? The one that's been bothering her, is that all right? Okay. Okay. My colleague's right, sometimes we do give drops instead of oral, but for young kids, often the cause is a middle ear infection, okay? And sometimes we need a couple of courses of antibiotics to kind of really improve things. So what I suggest we do is we give a different course of antibiotics, all right? And then I want you to come back and see us at the end of the week if things haven't really got much better. She otherwise looks, though, quite well in herself, and she hasn't got a temperature at the moment.
Simon did very well in this consultation, taking a very logical history and arrived at a diagnosis that he thought was appropriate. I ended up prescribing something slightly different. This wasn't a criticism on him, it was just a slightly different opinion, but I still think, according to his assessment, he made a very good judgment, and I think this is just part of the learning process for trainees.
Thank you, Doctor.
Okay.
Thank you.
See you later.
See you. Bye-bye.
So yeah, I think that was overall a really good history. I think it was nice and concise. Overall, it was a competent examination. Just be aware of the order, especially for your exams. It's good to do things in a logical order, to show that you've got a routine. Often with kids, do whatever's going to be least distressing first.
Okay.
So if you start with trying to, wedge their mouth open and stick down their mouth, then if you do that as your first examination, then you're going to lose them, and then they won't comply with the rest of it.
Hi, Daniela. How are you? Just take a seat. Hello, Dad. Let's take a seat. How can I help?
She have a problem with the lips.
Yes, I see.
It's been maybe 3 weeks.
Are they sore?
Yeah.
And do you have it mainly in these parts of the lips or the corners? Which is worse? Around there? Yeah, do you too? Yeah. Do you do much smacking of the lips? Which is like doing that. It's usually a habit children get into, even adults sometimes, you see them, adults with it, and they smack their lips, and that causes irritation and inflammation. This is a perioral dermatitis.
Yeah.
It's an inflammation of the skin around the mouth. The key thing to do is to keep your lips fairly well moisturised at all times, even at school. And do you like school?
Yes.
Yeah. Are you kind of top in your class, or are you pretty near it, or?
I'm near the top in maths.
Are you really? Good for you. And so what do you want to do when you grow up? Do you have any idea? Have you decided?
I might be a teacher, a math teacher.
Good teachers, so important, as you'll know. Yeah. Okay, so we'll give you some treatment for that. This is a cream, and it's antifungal. And then this one is a steroid cream, and you need to apply it to the corners of the mouth and the pink area and
the lips.
The lips, yeah. So hopefully that will sort it. But I think the key thing is avoid lip smacking. Just leave your lips alone, basically. Okay? Good. Yeah, nice to see you.
Okay, thank you, Doc.
Yeah, you're welcome. All the best. Keep up your good work at school.
Yeah, thank you.
Very important. Bye.
Yeah, bye-bye.
You look very smart, don't you? Have you been to school today?
Say yes.
Have you just started school?
So, Marcus, what are you doing today, then? What's the plan?
Going to school.
No. My plan is playing my Xbox.
Play your Xbox.
Have you been eating lots and lots of your favourite things?
Yeah, like carrots at school.
That's very good.
I would keep off school for a few days.
A couple of days off then. I think you said a couple of days.
Good girl. High five. Good girl.
Thank you for waiting.
Eye hurt.
He's always had problem with his eyes.
Yes.
But
Obviously, it's been a while. He hasn't had it, and he just got up in the morning and it's all swollen up again.
Yes, okay, let's have a look. When was the last time he suffered with this?
It's been a while now.
It's been a few years, has it?
Had it, yeah.
And when did the eye swelling occur again?
Yesterday, when he came from school, it was all swollen up.
Yeah, my
It was red, and then it started swelling in the morning today.
No, my friend pushed me off it. My friend pushed me.
Your friend pushed you?
Yeah, from school.
Did he? And what were you playing with your friend? Were you playing football?
I was playing football in school.
Who scores all the goals? Do you score all the goals?
I got 68 pounds in school.
Okay. All right. All right, Lena, why don't we just close your eyes? I'm just going to have a look there. Good boy. And open your eyes for me.
It's right over here.
Yes. Okay. This goes into your ear. Which ear should we use? Should we use that one?
For listening.
Yes, we're listening, yeah.
Thanks, sister.
Let's put that there. Good, temperature's perfect, okay.
I got 10.
You got 10?
The eyes are absolutely fine. There's no eye involvement at all. He does have the right eye, upper eyelid swelling, and there is some redness. It's also a little bit warm. Now, eye cleaning is essential. So what you do is you get hot water, use a flannel, compress it against the eyelid, try and do that for a few minutes, at least 4 times a day, okay? But in addition to that, what I'm going to do is I'm going to give him some antibiotics because it's red, because it's warm, because it's swollen. Okay. Back to school?
No.
No.
There you are. Good, all right, then, no worries.
I need to stop.
Say bye-bye.
Bye-bye now.
Thanks.
Come in. My name's Andrea. Have a seat. You're here for
preschool boosters.
So it's 2 injections. So it's the MMR, measles, mumps, rubella, and the tetanus, polio, whooping cough, diphtheria in one. Okay.
So where's he got to have these in the
So
arm?
one in one arm, one in the other.
Oh, no.
Yeah. How are you? I like your boots.
It's getting hot. Got to take your coat off.
No.
Yeah.
No. No.
Let me get it all ready and then.
Come on. She needs to check your muscles.
No, I don't want to.
It's not going to hurt.
Do you like stickers, Valentine?
Stickers.
Do you? Because if you're a good boy and you have this done, we can give you some stickers. Does that sound good?
Come in then.
So if you go over to Daddy, and I'll come over, and I'll get you the stickers afterwards. It's like bribery, but... So, as with all injections, may get a little bit of a temperature afterwards. Just give them some Calpol or something.
All right.
You're going to be brave. And I can give you a sticker saying I was brave. Yeah. Does that sound good? Okay. So, what I need you to do is be very brave for me and stay still. Is that okay? So I'm going to put one little injection here and one here. It'd probably be easy if he goes around the other way so you can hold him tight that way. Is that okay? If you put your hands here like this, you do that and then you can get a sticker. Yeah? And then Daddy can give you a big cuddle.
I got the stickers ready.
Don't know what the age is when you get too old for stickers.
Yes.
Look what I've got, Poppet. When you've finished crying, you might want to stick them. There you go, Mummy.
Thank you.
I'm happy with my treatment. Oh, you can have them all.
Yeah. We've got owl, we've got tiger, whale, or monkey.
Oh, do you get stickers?
Look at this, James.
You've been a very good boy, haven't you?
You want another monkey? There you go. That's it. Good girl. Well done.
Wow. Got a sticker. See if you can hold his arms still, because the more... Look that way, sweetheart. Look that way. Stay still for me, darling. Good boy. Well done.
Good boy. Good boy.
And then we can have a sticker. Good boy. Nearly done. Just stay still, or it'll hurt more if you move, sweetheart. Good. That's all done. There. Which sticker would you like? Which sticker would you like? You choose.
Which one do you like? What's the
Oh.
Kiss it.
It'll be all better soon. Which one do you think you like? Which one would you like?
Which one do you like?
Oh, the tiger.
You put your jumper on, yeah?
Should you put it on your jumper? You can take those off when you get You're so brave. All done. Where do you want your sticker? You put it on your top. You were a brave boy today. All right, take care. Bye. All right, take care.
His name's Irish, but everyone thinks it's Jewish.
All right.
You take a seat, or yeah.
Hi, Karen. How are you?
All right.
Good. How can I help you?
Well, before the summer holidays, my sister shut a door.
Yes.
The glass one. My hand went through it.
That's terrible.
And it was 1 millimetre away from my main artery, and I had to have surgery on the Friday. So
Yeah.
I had to miss football training for all the summer holidays.
Oh dear.
It's been hurting really badly.
Yes.
And it stays for about an hour or two.
Right.
And it goes, and then it'll come back later on.
Okay, what sort of pain is it?
Sharp, like a stabbing.
Right.
And then it changes colour a lot.
Right.
1 minute it'll be like that.
Mm-hmm.
Next minute it'll be red, like that.
You're just a bit worried about it.
Yeah.
Okay.
The pain is so bad when he comes in. He plays a lot of football, so we've got him a support for it.
Yes.
And I said to him, maybe because it's getting cold now, it's starting to really hurt. I don't know if that will affect it or not. And I appreciate there's probably a lot of scar tissue. The surgeon did say, realistically, it's going to take a year for everything.
So it was quite bad, wasn't it?
Yeah, it was really, really deep. I'm trying to put bio oil on there because of the colour of it. He doesn't like the sensation of it being put on there.
Right.
He really is like...
At school, I went to get an ice pack, but the ice doesn't really work or help.
Okay.
And it either does heat, nothing really can help it.
Let's have a look at it then, okay. So I'm just going to see, is it all right to touch it?
Yeah, just as long as it doesn't hurt.
Just going to see if the skin is tethered underneath at all. Can you wiggle your fingers for me? Make a fist. Bend your hand up, like that.
Whenever we go shopping, so I help my mum. If I lift it up, it hurts, and it just starts digging in.
Yeah. You've got what we call a hypertrophic scar there, so it's quite a thick scar, so it does take quite a long time to get better, but it will get completely better. You won't have any problems going forward with this at all, I'm sure. Good idea to massage it, and if you do it, you'll get used to touching it and feeling it, and you won't feel quite so scared of it as well, because it's all been a bit scary, hasn't it? I would imagine.
Yeah.
And what happens is that scar will go paler and paler, so eventually it'll start to go sort of almost a whitish colour, nearer the colour of your normal skin, and no one will be able to see it, I'm sure.
So it's really important that you just start massaging it.
Massaging.
Also, sometimes there's a little bit cut.
Okay, so sometimes it splits, does it?
Yeah.
I see. At the moment, it's still a new scar, and it's not going to heal very easily if it does crack, so really moisturise it well.
Okay, cool.
All right then.
Okay,
Thank
that's
you.
going to be fine. Don't
I'm going to
worry.
stay in, okay? That's my appointment. See you in a minute.
Thank you.
Bless him.
You got your princess crown on. It's not a princess one, is it not? Oh.
It's a pink one.
It's a pink one. How can I help?
I think she might have a urine infection.
Okay, she had urine infections before?
No, but she's been potty trained for quite a long time, and she's been wetting herself a lot the last week.
Okay.
And
she's not got sore down there because she's been wetting herself?
No, I checked it, obviously, when I was changing her, and it is slightly red.
Mummy,
but
don't talk like that.
oh, sorry. But yeah, she's got. I think.
Oh dear me. Now, are you going to be able to do a little pee for me?
We did try at home.
Yeah.
Mm.
Do you think? Smile. Do you think you can do a little pee in a little pot if Mummy tries to catch it in the toilet for me? and then we can test it.
I don't need a pee yet.
Oh, okay. Well, we'll have a go in a minute then. Is your tummy sore anywhere? Is any soreness in your tummy?
This bit is sore.
Is it all the way up there? Okay. Do you want to jump up on the couch?
My belly boots are muddy.
I'm going to take those.
That's it. Oh,
That tickles.
have I got cold hands? Okay, that feels all nice and soft. That's good.
Yeah.
All right, do you feel like you can do a pee now? Now I've pressed on your tummy?
No.
Just try and just catch a little
Yeah.
bit with
Oh,
that.
I need
Cotton. Oh, she needs one. Good.
Come on then.
I'll be back in a minute.
All right. See you soon.
Up here, sweet.
So I'm going to use one of these, look. I'm going to use one of these.
Watch what the lady does.
And it's going to change colour. I'm going to pop it in here, like that.
It's getting
It's going to change colour, look. All right, so that looks okay. So we'll send off the urine to the lab, so that will check for any infection. Just in case she's getting obviously a bit of a rash, so just some Sudocrem just to help with that. All right, so we'll send that off. But if you feel she's getting worse over the next couple of days, then obviously bring her back.
Sure. Thank
All
you
right
very
then.
much.
Bye-bye.
Bye.
Just Hi there, come and have a seat. So, problems with the tummy, is that right?
Yes.
So tell me about it.
Oh, I woke up and I vomited,
Okay.
and then for a few hours I didn't eat my food, my
Yeah.
breakfast.
Yeah.
In the afternoon, my tummy starts hurting.
Okay. Where is it hurting? Can you point?
The lower stomach.
You going for a poo? Yeah? And you passing urine, you weeing okay? No problems like that? He's never had an appendix problem before or anything?
No.
No. Okay. And you said you're not eating and drinking something or nothing?
I keep on giving him water.
Okay. I just want to check your temperature first, okay? I'm going to put this here. Can I get you to stand up for me? And just open your mouth. Say ah. Okay, and then just lie down. One here. So if I push here, it's okay? Is this hurting here?
No.
So it only hurts if I push here?
Yeah.
So that you can feel?
Yeah.
Oh, yeah. Okay, fine. Let me get you to come sit back up. Okay. What we worry about is if you've got pain here and he's looking dehydrated, he's been vomiting, not eating as much, and he's a little bit tender where I'm pushing, you worry about an appendix. So I think I'm going to refer him to the surgeons. And you worry about an appendix. You know what I mean by appendix? Like appendicitis, have you heard of this before?
I'm a theatre nurse.
Oh, you're a theatre nurse. Okay, fine. Yeah, so I'm worried about appendicitis, basically. On the one hand, I think it fits. Like you know, we've got the temperature symptoms. Actually, his throat is completely clear, and he's got tenderness where you'd expect it to be. But on the other hand, actually, I had to push quite deeply to elicit that tenderness, and he doesn't have any rebound or guarding. So I'm sort of 50-50. But he looks a little bit dry to me. He's still got a temperature
he's
now.
not drinking as much.
Exactly, and but also is that because of the appendicitis directly? He's still got a bit of a temperature right now. It's 37.6. So I think I'm going to refer him to the surgeons. Okay, so let me just talk to them now. Yeah. Are you okay to go to the hospital from here?
Yeah. What is good for him?
Well, hi there. My name's Mr. I'm one of the GPs for Farnham Road Surgery. Can I refer a patient to you, please? So, 8-year-old boy who's had a 12-hour history of abdominal pain. He vomited once this morning. He's had a temperature on and off during the day. He's off his food. But I still think the appendix is more likely than anything else. Thank you. Cheers. Bye. So, we got there in the end. Okay. So he's expected by the surgeons, give them the letter, and then they will call the surgeons to come and have a look at him. Okay?
Thank you very much for your
No
help.
problem. Take care.
Thank you.
Thank you.
Bye-bye.
Bye.
See ya.
You're right. I mean, he's very flat-footed, so what I'm going to do is refer him to the pediatrist. But that will need some correction. But if he's not, you can't sort of correct it before he starts to walk because it's of no use.
Oh, I know that. I used to have boots when I was younger because I used to walk on the inside of my foot as well.
And he's doing the same. So I think he may need something like that. What I'm going to suggest is if you can keep encouraging him, because some children are slow to walk, and if there's a family history, it tends to run in family. I'm not terribly worried even at 18. Some children up to 2. If it's after 2, then you sort of begin to think of other things. But I think because of the very strong family history, because he's got what we call a biomechanical problem, that's probably not helping him. Okay? I mentioned that Malachi had a biomechanical problem, and in his case, it was his feet turning in. It may just need a simple type of boot to help correct the in-toeing. It may need some physiotherapy. If it was really bad, there are some cases that need surgery, but that's very rare. If you come back to see myself or Dr. Ward, because I have a special interest in musculoskeletal things. Okay.
Thank you, my dear.
Okay.
Can you open the door for me?
Can you get it?
Can you do
Pull
it?
hard. Now, this is a very heavy door. Yeah.
Pull! Yeah,
Pull.
he's got strong muscles.
He obviously has.
He's my superhero, that one.
Good. Okay.
Thank you.
Take care.